we are introducing a paradigm shift in airway management. The newly designed and patented V-cuff endotracheal tube features a viscoelastic, self-expanding, biocompatible cuff that extends from the supraglottic, glottic into the subglottic region, creating a highly effective seal and barrier. The cuff constantly adapts to anatomical structures, exerting minimal pressure on surrounding tissue. Additionally, the V-cuff includes reinforced and non-reinforced segments that counteract torsional, rotational, and lateral forces exerted on the tube by the airway. The tip reduces selective intubation, minimizes damage, and allows for better radiographic localization. Various studies of the device have been conducted over the past 5 years. In vitro studies were performed on tracheal models designed specifically for the study, and ex vivo studies were performed on pig tracheas, all showing significant superiority of the V-cuff. Bacteriological tests demonstrated a better seal and a lower risk of respiratory tract contamination. Radial force transmission has been compared with existing tubes on the market, and the V-cuff showed significant reduction in torsion transmission to the airway. In an anesthesia simulator with tidal volumes of 938 milliliters and PEEP of 20 centimeters of water, an excellent leak-free seal has been confirmed, reducing the compliance in the simulated lung. Generated peak pressures of 80 centimeters of water without any leakage. In animal studies, both in healthy and septic pigs with respiratory distress syndrome, the protective, comparative performance of the V-cuff in long-term ventilation has been demonstrated with clear macroscopic and histological benefits. A recent randomized prospective double-blind clinical trial in humans showed that the use of the V-cuff tube reduced the incidence of laryngeal postoperative injuries after short-term intubation. It also reduces the incidence of coughing and achieves better tolerance. Additionally, the V-cuff provided an adequate seal with much lower cuff pressures, despite patient movements and recruitment maneuvers. Results are pending publication in Anesthesia and Analgesia. The data was presented to experienced anesthesiologists, who are asked what would be the most important quality of this device, to which they responded lesser damage to the larynx, greater safety, decrease in perioperative nosocomial pneumonia, and a better suction channel. When presented to a group of intensive, the most significant characteristics of the V-cuff were lesser damage to the larynx, prevention of nosocomial pneumonia, continuous adaptable viscoelastic cuff, and safety. In conclusion, there was unanimous sentiment amongst anesthesiologists and intensivists surrounding the V-cuff endotracheal tube that this new device is a true paradigm shift in airway management. Thanks for watching. Medis Medical, the excellent airway management expert.